Good afternoon, everybody, and thank you so much for joining us today for our webinar, Women's Health at Work, From Policy to Practice. The session today will highlight the practical steps, the expert insights, and essential areas that companies need to cover when supporting women's wellbeing at work. Just to introduce myself, my name is Nicola Green. My role is Commercial and Trading Director for Bupa UK. I've worked at Bupa for 29 years now, which feels like a crazy long time. And that's been both across the provision side of the business, but also the insurance side. So it's actually really great to see how provision links perfectly into insurance as well. So enough about me. And we're going to start today with the session that we have planned ahead. And I just wanted to give a little bit of insight initially before we then go on to introduce our panel, talk about some questions, and then open up to further questions that you might have yourselves. So in today's rapidly evolving workplace, supporting women's health is not only a matter of equity, but also for business success and sustainability. This event today brings together thought leaders, clinical professionals, and business decision makers to explore how organisations can turn progressive policies into real impactful change. Over the course of the session, we'll dive into the latest research, we'll share practical case studies, and provide actionable guidance to help you create your work environments where women's health is actively prioritised. From tackling taboos around menopause, menstruation and fertility, to fostering inclusive cultures and championing best practices as well. Our aim today is to equip you with the knowledge and the tools to make a tangible difference for women at every step of their career. Okay, so moving on to the next slide. So by addressing the unique health needs of women, organisations demonstrate a commitment to equity and foster a culture of trust and well-being. So as recognising and supporting the specific health journeys that women experience, they're sending out a clear message that equity is not just policy, it's a lived value. This approach builds trust. It strengthens the sense of belonging with individuals and lays the foundations of a healthy and empowered workforce. Ultimately, creating a culture where women's health is prioritised, it's not just the right thing to do, it's a strategic step forward towards building a more innovative, resilient and successful organisation. Research also shows us that 57% of women feel that women's health is still treated as a taboo topic, and that 70% of employees currently use their sick leave to cover for fertility and health-related appointments. So as you can see from those stats, there is still so much work to do to address the issues that we're currently faced within women's health. But to reduce these numbers, organisations must keep challenging the taboos. We must adopt inclusive health policies and create open, safe dialogue and open, safe environments. With sustained commitment, real progress can be made towards a fairer, healthier workforce for everybody. Our new ebook on women's health is actually available. The publication offers expert insights and important information into women's health topics and effective workplace strategies that you can use. You're able to download the ebook by using the link that will be provided in the chat section as well. So hopefully you'll find that tool really useful. Supporting female health in the workplace is not just a matter of being compliant or it's a corporate responsibility. It genuinely is a strategic investment in the long-term success of an organisation. And by promoting female health, businesses not only enhance the employee retention and satisfaction, so we have a huge amount of benefits that we will bring by having these inclusive workforces, they also foster a hugely more productive and innovative and resilient workforce as well. So we can see just from my introduction there, the importance of the topic that we're talking about today. And I'm really pleased to be able to bring our panel onto the call today for them to be able to share their expertise and their insights, which I'm sure you will find super useful during the session. So let me start with the introductions. And first of all, I'd like to introduce Mel Islin, Membership Manager at Wellbeing at Work. We have Samatha Wild, Women's Health Clinical Lead for Bupa UK. And we have Debbie Clark, Head of Wellbeing at Towergate, and Alice Bradley, who is Head of People for Bupa UK. So thank you to all of you for joining me today. for the panel questions, and we'll put some great questions lined up for you. And as I mentioned a little bit earlier, we'll then open out the audience to be able to ask questions as well. Okay, so starting off then with the first question that we have. And for this question, I'm going to come to all of you if that's okay. And Mel, we'll start with you. And the first question is, why is women's health such an important topic for employers?
Thank you, Nicola. Hi, everyone. I am Mo Islin. I'm the membership manager at Wellbeing of Women. And if you're not familiar with Wellbeing of Women, we are the charity that supports women and girls' gynecological and reproductive health. We cover the life course, so everything from pregnancy and birth right through to the menopause and everything else in between, such as fertility, gynecological cancers and everything else. And I oversee our employer membership program, which provides employers with the necessary tools and resources to support and prioritise women's health at work. So it's ultimately really important that we do consider women's health for all employees. If we think about the workforce, more than half of the workforce are women. So we all need to be talking about and supporting women in the workplace. As you mentioned and highlighted, Nicola, actually the costs of not doing something really outweigh the need to the costs of not doing something really do highlight the importance of doing it, really. There is still so much stigma around women's health. We see more and more women who say that they don't feel comfortable or confident talking about women's health issues with their employer for fear of stigma, for fear of facing difficulties with accessing promotions or further opportunities. So we really need to open up the conversation. And actually, women's health really is everyone's business. There are men obviously in the conversation as well. They're going to be line manager women. They're going to have women in their life and partners, loved ones, friends who are all going to be impacted by women's health in some capacity. And then finally, if we think about the working life, the average working life of someone, if we're thinking sort of circa 45 to 50 years, if we think about the various life stages that someone is going to be going through during that time, and it's all going to be playing out in the workplace. If we don't support people at work, then obviously businesses are going to be putting themselves in a position where they're going to be losing talent. And we see it more and more. People are leaving the workplace because of severe symptoms of the menopause, for example. So it's absolutely imperative that we do support women in the workplace, not to mention the Employment Rights Bill that's coming into place and how that's going to impact employers as well.
Thanks, Mel. I think just some really interesting parts there. As you say, open up the conversation. I think it's about how we actually do that as well, isn't it? Often we can talk about the things that we need to do, but it really is making that become a completely comfortable, safe environment to be able to talk openly and overcome the stigmas that you talked about there. Thank you. And Sam, let's come to you if that's okay, for your view on this question.
Hi, thanks, Nick. So yes, I'm Dr. Samatha, a GP with over 20 years of experience now, and I'm the Women's Health Clinical Lead for Bupa Clinics. And my passion for this area is deeply personal. I've lived through the challenges of endometriosis and a surgical menopause in my mid-30s whilst working. And I've also supported many women over the years as their GP who've been navigating similar journeys. So, I've lived it, I've breathed it for a long time. So women often present late to their GP. They've suffered in silence for many years with symptoms that disrupt their work, their relationships, and their overall well-being. And issues such as the menopause, heavy periods, fertility concerns, or bladder issues can affect every aspect of their life. So it's not just physical, it's emotional, it's social, and professionally as well. And yet they're still too often overlooked or minimised, including in the workplace. So as GPs, we see the cumulative impact of this with misdiagnosis, delayed treatment, and the emotional strain on women feeling that they have to push through these symptoms without any support. And some Bupa research really highlighted the scale of this problem for women experiencing the menopause, showing that almost 900,000 women in the UK have left their jobs due to menopausal symptoms. So this represents a huge loss, not just for those individuals, obviously, but for organisations and society as well. And with the right support, this is preventable. So it's just a crazy situation to be in, really. And just to sort of reiterate again what Nick said, we know that despite growing awareness, 57% of women still feel topics like periods, menopause, fertility, and bladder problems remain taboo. And nearly a third of women feel uncomfortable discussing them at work. So this silence not only delays care, but it also limits those opportunities for support. So employers really need to create cultures where open conversations are encouraged and normalised. And back to the fact that we know that half of the workforce are going to face women's health challenges at some point in their careers. Employers really need to respond with empathy and practical support. And this isn't just about doing the right thing, they're investing in their people. And again, just to reiterate what we've already heard, if we support women's health, we're going to retain talent, we're going to reduce absenteeism, and we're just going to foster a culture where women feel seen, heard, and able to thrive. And just lastly, I just wanted to sort of emphasize that this isn't a size fits all approach. Every woman's experience is different. And so we've got to consider cultural backgrounds, neurodiversity, disability, and gender identity too. So meaningful support really must reflect that. So we need to ask women what they need, we've got to listen, and we've got to offer flexible options that meet their individual needs.
Thanks, Sal. And I think, a couple of parts that you mentioned there, women suffering in silence, coming late, who ask for help or seek help, it's really sad to hear that, actually, isn't it? And the more we can do to support that, the more we can encourage women to act earlier if they're struggling, they have symptoms, they need help and support. We can do that. And we talked at the start of the call about policies to practice. We can have policies in place for all of the areas that we need them as corporate businesses, but it's actually how we genuinely bring those policies to life that will truly have an impact and change culture, which is so important for us all. Thank you. Davine, over to you next.
I thought I was coming at the end, so
sorry, I'm mixing it up a bit then.
That is absolutely fine. So I'm Debbie Clark, Head of Wellbeing at Towergate Employee Benefits. I'm also the co-chair of our own menopause and menstruation support colleague community. I'm a menopause lifestyle coach and a mental health first aider who specialises in supporting women. I think my fellow panellists have probably said a lot of what I would say, but I just wanted to add on the business imperative, the fact that, yes, this is the right thing to do, but there is a business cost to doing it or not doing it. So having diverse workforces, especially in senior roles, which I think is particularly significant when we consider that the average age for a female to go through the menopause in the UK is 51. But corporations that are embracing that gender diversity on their executive teams have a 27% likelihood of outperforming their peers on longer term value creation and 19% higher revenues due to innovation. A different study showed that companies with over 33% female leadership enjoy profit margins up to 10 times higher than those without. So we're talking a lot about understanding that this is an individual issue, that this is could be different for every woman, but bosses, line managers, people in work need to appreciate that then these women struggling in work, it may not be a performance issue, but a health issue. So giving them some support will mean that they are back thriving again. And so having that right culture, and we'll talk, I should imagine, a little bit more about how we achieve that, means that the woman will feel psychologically safe and can then actually say if they're struggling, and then we can do something about it. From my work in the menopause support group, going back to something that Sam just said, the amount of times people have gone to see their GP and unfortunately either been dismissed, potentially misdiagnosed of a sort, or given the wrong treatment panel and have had to keep fighting, particularly maybe for issues with menstrual health. It's phenomenal. So the amount of time and energy that female is wasting trying to get the support that they need outside of work. So a little bit of sympathy and empathy in work can make all the difference to them.
Well, you talked about the psychological safety is so important, because you could be a top performer and then go through this period that's, you know, a difficult period, it completely knocks your confidence. It absolutely can affect your performance, but it's a short-term issue, and it's not a performance issue. Exactly, you say it's a health issue, which then, when supported and able to get in a better place, absolutely get back to where you were feeling before. And I think it's quite common that we hear that, and actually, you know, really sad that women can feel that and not know that they can get back to exactly where their capability levels were previously. So it's a really important area to talk about. Thank you. Great. Alex, over to you.
Hi, everyone. This is a great conversation to be part of on a lovely Tuesday afternoon, isn't it? My name's Alice Bradley. I'm the head of people for Bupa Health Clinics in the UK. And it really is a pleasure to be here discussing a topic that's not only close to my heart personally, but is really increasingly central to how we shape inclusive and really happy, healthy workforces. Again, I think a lot of what I was probably going to cover has sort of been touched upon by the rest of the panel already, but I think just really kind of honing in on the part that women's health is an absolutely integral topic for employers. It directly impacts your workforce well-being, your retention, subsequent performance. And really, for too long, issues such as menopause have really gone under-recognised in workplace, in kind of policy and culture. There tend to be kind of quiet conversations that happen in really kind of private spaces, rather than sort of these legitimate occupational health concerns, which is really what they are. But the reality is that these symptoms that come kind of associated with some of the women's health, I suppose, challenges that people face across the course of their working life really can significantly impact somebody's ability to thrive at work. So whether that's performance related or just kind of that flexibility option that perhaps they may need. So yeah, I think in summary for me, this is just an absolutely, you know, a great conversation to be part of, and extremely timely as well, given the new legislation.
Absolutely, which links me perfectly onto my next question. So thank you for that, Alice. Almost like we practiced it. So there has been a recent change in legislation. So understanding the legal landscape towards menopause and the essential areas to cover will naturally be our next focus. So Alice, staying with you for this one, would you be able to talk us through this, please?
Yeah, of course. And I think it's, you know, it's really vital that everybody takes some time to learn about this, I think, is the key thing here. So I'm going to give you a little bit of a summary of it here, but, you know, I'd really advocate go and understand what this means for you, go and understand what this means for your people, and really start to think about it, if you haven't already, as an organisation, in terms of what you're going to be doing. So, you know, we've talked a bit about the kind of the cultural importance here of really making sure that we're supporting women's health. But the legal landscape that surrounds us is really rapidly evolving as well. So in summary, the Employment Rights Bill passed in late 2024 and is expected to come into force from 2026, really represents a landmark moment for workplace equality. And I suppose for the first time ever, menopause has been explicitly named in UK employment legislation, alongside other areas such as gender pay gap, parental leave, all areas of which, you know, absolutely work hand in hand together to make sure that we are really focusing on that cultural piece that is integral to the success of an organisation. In practice, what does this mean? So for large employers, and these are people that are employers that are considered to have kind of 250 or more employees, there's going to be a legal requirement for them to publish a menopause action plan. And the plan needs to be really, I suppose, focused on how an organisation plans to support employees that are experiencing menopausal symptoms. So expected to include measures such as flexible working arrangements, things, sort of nuanced things around kind of temperature adjustments, potential uniform kind of queries and conversations that you might want to be tabling, opportunities to explore paid leave, rest spaces, but also really advancing what is available to employees in terms of access to treatment or support services. So that's kind of, you know, the context for a large organisation. And all of those plans, and I think this is the critical part, needs to be not only sort of approved by leadership, but really bought into by leadership and understood. And I think a critical part of everything that we're talking about today is education. You know, this is not just about women learning about women's problems. This is not just about kind of families understanding how to support people at home. This is the round, everything in the round, and really creating a space that, you know, it allows women to thrive in the workplace in the way that they should do. those plans will need to be revised. They'll need to be kind of reframed regularly and, continue to be adaptable based on kind of the environment and how workplace culture shifts just generally through time. For smaller organisations, so again, kind of anything sort of sub 250 employees, there's not going to be sort of a legal obligation in this space. Government are going to be issuing voluntary guidance, essentially, which will really help these individual kind of organisations start to think about measures that they may want to implement. And these are really kind of focused on those support mechanisms. So recognising support, understanding how they're going to educate their leaders, really thinking about kind of those opportunities to support people through different life cycles in ways that they just have never gone into before. I think the other thing that's probably quite poignant and something to kind of pull out here, it's all very good and well as having legislation and policy and things that, quite frankly, we should just be doing anyway. Menopause is actually now recognised as a potential basis for claims under the Equality Act of 2010. So this kind of sits alongside sex, age, disability discrimination, and there has already a recognisable shift in menopause-related tribunal cases, which I think, just makes proactive compliance not just ethical, but absolutely essential for employers. So, a really clear signal for us here around moving away from this just being a nice kind of conversation, a tick box kind of, I suppose, chat that you might have to actually, this has to be, we have to put things in action now as employers. It's not enough to just acknowledge that the menopause happens. We've got to be embedding really meaningful support into our policies, into the environments that we're working in, but critically into the leadership behaviours that we display as well.
Absolutely, Alice. And, exactly as you say, though, it's not a tick box exercise because we have to do this because the legal landscape has changed there. And so it's what we do with those action plans that's absolutely key to be able to change the cultures and drive that change. But this is an amazing way to be able to really jump forwards into making that change. Yeah, absolutely. And Mel, have you got any builds on that you'd like to share?
Yeah, I mean, I think a lot of really important points have been covered. I think the key thing from our perspective is that there is going to be guidance for employers. A lot of the employers that I speak to, there's still so much uncertainty about what this actually means in practice. They understand the requirements, they understand that, that the bill and the new legislation is coming into effect, but actually in practice, what do those action plans actually look like? What do they need to be included, but also from, an accountability perspective. And it's obviously just been touched on, but we need to ensure that this doesn't become a tick box exercise because it's a legal obligation. What we need to be really encouraging, and this is something that I always speak to our employer members about, is actually, and we've talked about this already through the session already, but it is about that culture change, and it is about creating psychological safety, because without the culture change, you run the risk of it becoming a tick box exercise where these action plans are coming into effect because we have to do them, but actually from a culture perspective, there isn't necessarily going to be that buy-in. So what we need to make sure is that we've got a combination of the two, that we do get that senior level buy-in. Because yes, it might be a legal requirement for some, but there's also that moral obligation as well. We want organisations to support their people. And I guess also where we know that there's going to be the legal requirement for organisations who have more than 250 members of staff is obviously not going to be mandated for those that that have less than 250 members of staff. So just because, again, it's not going to be a legal obligation for them, they've still got a moral obligation to their staff to support those women in the workplace. So it's about how do we support those smaller organisations to think about that and gaining that senior buy-in, and consider what they can do as well. And that's something that we're going to be also really, really driving forward and advocating for.
Can I jump in here, Nick? When we were looking prior to this becoming legislation, but in terms of an employer sort of knowing what good looks like, the British standards, the BSI, have specific guidelines for menopause and menstrual health. I had to just quickly jot it down. It's the 30416. And that gives a really good starting point for people looking to do something proactively in their organisation.
Brilliant. That's great. Thank you, Debbie. That was exactly what I was going to ask. That, if you are an organisation where do I go to then understand what does good look like? What are the guidelines? And, whether that's a large corporate who have to do that, or whether it's an SME that want to do that and do the right thing. So that's brilliant. Thank you so much for building that. Lovely. Okay, so we're going to move to a more clinical perspective now in the next question. So Sam, this is obviously for you. What can we all do, especially in the workplace, to support women's health?
So I think there's 4 key areas where workplaces can really make a big difference. So first of all, as we just heard, starting with awareness and good education. So many women's health conditions are common, but they're poorly understood. And as I said earlier, often stigmatized. 1 in 10 women has endometriosis, 1 in 3 experience bladder issues. Every woman's going to go through the menopause. So these aren't niche concerns, and they are part of everyday working life. So normalizing the conversations around these topics really helps to reduce stigma and encourages women to seek help earlier. And it helps colleagues and managers to understand that the impact isn't just physical. Fatigue, brain fog, anxiety, low mood, or sleep disturbances are often just as disruptive for women as having hot flushes or pain or bleeding. And actually, these emotional symptoms can trouble women even more sometimes than the physical ones. The education's got to be inclusive. It's got to be ongoing as well. And, we've talked about different resources, but at Bupa, we've got some comprehensive training sessions as well, a women's health hub to equip employees with tools and information to help them manage their health effectively. And again, all these sorts of resources will just really help normalise that conversation. There's brilliant campaigns like Just a Period that people can access. Menopause cafes are excellent in the workplace as well, encouraging sort of that empathy and that peer support as well. And you can appoint menopause or fertility champions within your business too, to really foster those peer-led safe spaces and signal that women's health is really valued. I think second, access to the right clinical support is crucial as well. As I said before, too often women delay seeking care, sometimes for years, because they don't recognise their symptoms as medical issues, or they fear being dismissed, or unfortunately, as you heard earlier as well, they have been dismissed or mismanaged. So as GPs, we see the consequences of this delay, and conditions that could have been managed earlier have become far more complex and harder to treat the longer that they're left. So employers can be signposting or even providing trusted services. So this might be NHS pathways or occupational health or private options like Bupa's menopause or period plans. But we know that early access to evidence-based care can really dramatically improve the quality of life and the longer-term health outcomes for women. And it prevents long stretches of sickness absence or even women leaving their jobs.
Exactly.
Yeah, and I think, stigma in the workplace often means that women feel that they've got to manage their health in silence as well, even when they have got a diagnosis or they are undergoing treatments. They're worried that they, might affect their career progression if they speak up. So there's further barriers to support later on as well. And the third point is practical workplace adjustments. So small changes in the workplace can make a huge impact again. And these adjustments aren't just about comfort, but they're about dignity, inclusion, enabling women to stay in the workplace. So flexible working, as Alice mentioned, these can be life-saving for people that are undergoing fertility treatment, for example, or managing severe period pain or navigating menopause-related fatigue. Private spaces for rest, for administering medication or managing symptoms discreetly. And this just helps women feel safe and respected. Uniform design can make a difference. Access to appropriate facilities such as temperature control, hydration stations, bladder-friendly toilets available. All these sorts of things can make a massive difference. And as we said before, these adjustments need to be visible. They need to be accessible. They can't be buried in HR documents somewhere that nobody's going to read or access. Women need to know what's available, and managers need to be equipped to offer these options proactively. And then finally, again, I would just go back to culture is everything. The workplace culture has really got to be open, honest, everybody normalizing these conversations so that, women know that they can ask for more. I came across a campaign earlier called Men Ask for More, which was encouraging men in workplaces to really be active allies for gender equality and pushing for changes in workplace policies. But I think women need to ask for more in the first place as well, and it really helps once one woman has stood up and asked for something. for people to see that implemented in practice then and think, oh, actually, I could do something, or I could ask for something as well. It really helps build that trust, and just encourages others to come forward. So, that they would be my 4 key areas, which I know is sort of reiterating everything that everyone else has said, but the clinical bit doesn't just stand on its own. It's amongst the rest of that culture.
I think as well, Sam, an area that, that I think in the workplace is difficult is, and you've touched on it there in all of the updates, is so as a manager, where do I go to? What clinical pathway would this person have? Do they have private options? Is it NHS pathways? And sometimes that lack of knowledge to know where to go. And I think you mentioned that there's women's health hubs. So again, organisations having those hubs that can signpost managers on how to support their teams is really helpful, because if you don't know the answer, you're not confident, often you'll just not have that conversation and probably, move away from it rather than face into it to look at how you can support, because it's not because you don't care, it's that you don't necessarily have the knowledge to know how to support a person. I think that can be really difficult as a manager to manage that situation.
Yeah, we created a line manager toolkit, and a big part of that was about signposting and just giving them a little bit more confidence. Trying to, maybe if you are doing awareness sessions, do them specifically for line managers so that they can ask questions without feeling embarrassed that they're asking something that they feel perhaps they should know in front of, especially, and I don't like stereotyping, but especially men, and sometimes also women that haven't suffered themselves, so that they don't get it in the same way. But yeah, there's some fantastic resources, but if you don't know where to go, so trying to put a simple crib sheet together for line managers and for employees, but keep them separate, can help.
Yeah, absolutely. That is so helpful. Thank you, Debbie. Okay, so we're moving on to the 4th question, and Debbie, was staying with you for this one first up, if that's okay, unless I'm changing the order around again, which possibly. Okay, so this question, what are some of the best examples of how companies are addressing and supporting women's health? So over to you.
So funnily enough, it completely dovetails in with what Sam was just saying. So my first comment was culture. And I don't want to labour a point, but this can be particularly difficult if you're in a male-dominated environment. So it really does need to come from the top down, and that reiteration that, okay, 50% of people are going to face this directly, that the other 50% of your organisation could be impacted by it, whether that's at home with a family member, a mum, a wife, a daughter, or if it's in work with a colleague, member of your team that you're managing. And to go back to what Sam was saying about someone coming out and actually asking for the help and then seeing others follow, if that could be someone senior, that seems to just add a little bit more weight and power to that process. I think that there is some great stuff going on. And I don't want to particularly mention them just because they're on the call, but I love Wellbeing of Women. They have got a menopause pledge. They're just a period where there's a period tracker that you can put your symptoms in. So as a line manager, having access to a period tracker or a menopause tracker can be a really nice way to sort of give support without having to get involved in all the detail. And then that would empower the individual to go to their doctor. Henpicked is another company that does accreditations as well. And both of those pledges and accreditations is all about creating the right culture, and they'll give you support and steer on what that might look like. We spoke at the beginning, I think, about having a menopause or a menstruation policy in place, or a framework. Whilst they're not essential because the culture is more important, I think they do give a statement of intent to employees that this is something that the company cares about, and therefore here's a point of reference for those that are struggling. Another thing we're seeing that companies are doing more of is having female health as a specific reason for absence or a specific option in exit interviews, which means it can suddenly be specifically tracked and measured, which is great for then knowing that you've got your business case for investing in it. We've spoken loads about training, education, awareness, and that's need to signpost to good quality, validated information, making sure you're signposting for women, for line managers, for allies, for supporters, training menopause champions or menopause coaches. One thing we found really impactful is sharing colleague lived experiences. So if you have a colleague that's prepared to document or do a short video or come onto a webinar and talk about how it impacted them, it's amazing how that then triggers other people to say, oh, I had that. And whilst you don't want somebody else to be suffering, there is something nice about knowing that you're not the only one going through it. Very sadly, we did a webinar just last week about menstrual health conditions, so endometriosis, polycystic ovary syndrome, PMDD, fibroids, etc. And prior to that, I had a male colleague say, oh, my wife is really struggling. I'd love to be on the call, but is that okay? And so we've still got work to do to make it acceptable for everybody to join these calls as well. We've touched on peer groups. So Sam mentioned menopause cafes. We talk about our colleague community. You could have a coffee morning group, somewhere where you can get peers together to talk about what they're going through and share ideas and support. If I've seen the words itchy skin on our menopause support chat once, I've seen it a million times. It seems to be something that comes up, and the amount of people that have tried products that haven't worked or have worked, and yet, you know, we're all there to share. And taking a bit of a breath, it would be really remiss of me not to mention employee benefits. There are some that are specific to supporting women's health and are labelled as such, from menopause support to menstruation, fertility, infertility, hormone tests. But others may be hidden in the employee benefit, or you may not actually put two and two together. So things like employee assistance programs, virtual GP services, mental health support, physiotherapy. Yes, it may not be dealing with the specific of the condition, but it might be able to help you with some of the symptoms. And just like Sam said, it's about not just having them, but knowing how to access them, and that everybody's aware of which bits might be beneficial to them.
I think as well, Debbie, what was really interesting there when you talked about the male colleague and would it be okay for me to join? And actually that education and awareness is so helpful for, you know, for males as much as females, because they will naturally have females around them in their lives, whether it's parents, whether it's, you know, siblings, whether it is partners. So it's so important, and it is something that we really need to continue to focus on to make that completely okay as well, and very much welcomed in all of the women's health discussions that we have. Mel, have you got any bills that you'd like to add on to that?
I do, yeah. I mean, Debbie, I think you've just given a really detailed overview, and as Debbie mentioned, at Wellbeing of Women, we do have loads of health information available on our website. We, like Debbie also said, that we've got our period symptom checker, which has been such a valuable resource for anyone who's experiencing heavy, painful periods. Because what it does is a free tool that the employers are able to provide to every member of staff, and any female can access it. And what it will do is it will generate a letter that you can take to your healthcare professional if it's deemed that you do need to seek some support for it. The uptake has been incredible. We've had over 45,000 people complete the checker, when it was only launched about 6 months ago. So again, that's free to access. And kind of building on what Debbie was saying about policy. So through some of the organisations that I work with, Many have implemented things like menopause policies, fertility policies. But there is also another route. So where some organisations opt not to have a specific sort of well-being policy for a particular sort of life stage, what some opt to do, they have broader women's health policies that encompass all of the life stages and well-being issues. Or what we also encourage people to do is, if they don't want that, is look at within their leave policies and their sick policies of how they can incorporate women's health issues within those. So one organisation, they have included 5 days paid leave for anyone going through fertility treatment, and 2 days paid leave for partners, regardless of whether their partner is working for that organisation. And then linked with that, it's also things like, and as Debbie mentioned, about having things like the menopause as a reasonable justification for having time off work, because again, employers are able to track legitimately why people are having time off work and for sick leave and things like that. Because if things like the menopause or painful periods aren't a justification for taking time off, then actually people are going to be using other reasons for it. So you're not accurately able to identify where women's health issues are really causing an impact on people's reason for taking time off. The other thing that we encourage organisations to do is think about actually a women's health strategy. So again, going back to that conversation that we've already talked about quite a lot around culture changes, how can an organisation have a strategy about how they're going to be supporting women in the workplace? Things like menopause cafes that we've seen. Some organisations, they have series of webinars across a whole range of health issues, and they include women's health. One of our employee members actually did a session on women's health, but only invited men to the conversation, because what we're hearing more and more is we can invite men into the conversation about women's health, but there's often a fear of saying the wrong thing, the fear of stigma. It's still a bit of taboo for a man to be talking about women's health issues. But if we only invite men into the conversation, that opens up a space for men to be asking the questions that they may otherwise feel like they can't ask in a room full of women. And even really, really simple things that employers can start doing, like period products in shared spaces. Now we're thinking about not just women's toilets, we're thinking about all shared spaces, because what about people that don't identify as a woman? What about trans men? What about, people who identify as non-binary? So we need to be thinking about people in those sort of situations, about people who'll be impacted by women's health issues but won't necessarily identify as a female. That is also an interesting conversation that we need to be thinking about. And then finally, also using, we're in sort of coming up to October now, so it's Menopause Awareness Month, and thinking about, okay, well, the conversation is really going to be heavily based on the menopause, but how can we use the menopause as a gateway to opening up the wider conversation about women's health?
Absolutely. So much great information shared there. Mel, thank you so much. And I really love the male session that you had, because I think you can completely relate to that if it's not something that you feel completely comfortable in that environment, you're less likely, even if you attend, which is great, to Debbie's point before about can I join it, but the confidence to really interact and ask questions and feel super safe and is probably unlikely to happen in that environment. Whereas amongst similar people, the confidence will be there to probably ask what they think might be silly questions, or I don't really understand this, how does this work? So I think that's an absolutely fantastic way to be able to overcome that. Thank you. Okay, so we are at the end of our questions with the panel. So we're now moving on to the Q&A questions. So I'll be scrolling a lot. There's lots of questions. So what we won't do is probably get through all of them in the time that we have. But what we will do is prepare answers to the questions and make sure that we come back and share those. So I'm just going to start first of all with the first one, which Sam, I think probably a great one for you to answer would be a little bit more around the symptoms and what to look out for, probably more. So you might know your own symptoms, but how do you observe symptoms in team members to be able to understand if you think that they might be suffering and not talking about it?
I think sort of more generally, if you have managed to build up a good rapport with your team and you sort of, you've got that relationship there already, then just sort of sensing that things aren't quite right with them can be a good starting point. And just checking in with them and asking if they're okay. I mean, there's at least 34 symptoms of the menopause. So we're not expecting that everybody, knows every single one of those and is able to list them off. But but being aware that they may not be physical, they might be psychological and those more sort of emotional symptoms, but just, you know, realizing that somebody may not just be performing at their usual sort of levels, that things aren't quite right. They may have been absent, and just checking in and asking if they're okay. And then, you know, they may then feel that they want to share with you, but we're not asking people to be doctors. So we're not asking them to be aware of every single symptom that woman might be experiencing. And as we've said, everyone experiences symptoms differently anyway. And, you know, somebody could be in a lot of pain, but actually it's not the pain that's really troubling them. Or we always talk about hot flushes with the menopause. And actually, for the majority of women, it's hot flushes don't bother them at all. It's the fact that they haven't slept all night that's the issue. It's the fact that they feel they've you know, developing Alzheimer's, or they're losing it because they can't remember things. They can't remember why they went into a room. So it's so I don't think it's necessarily, you don't need to know all the symptoms, but it's just being aware that women are affected differently, and that might therefore be related in how they are showing up and how they are performing at work. We've got big long symptom checkers if you can, obviously AXA as part of the education, but you know, I don't need people to remember those. You don't need to be a doctor, but you need to be able to signpost in the right direction for that person to get the right support for them.
Brilliant. Thanks, Sam. Okay, there's lots of brilliant resources that have been popped into the chat as well. So just please do take the time to scroll through and have a read. There's lots of useful information in there. A couple of bits I'll pull out, and then Alice, I will come to you for a question if that's okay. So there was questions around the guidance and being issued. And so the BSI 30416, which Debbie talked about, the British Standard for Menopause and Menstrual Health, offers the free guidance. So again, you can just get hold of that access. It will have everything in there. The guidance is there. It is a free resource for you, which is perfect. Okay, Alice, the question I'm going to come to you for is, while great shifts are happening, men are still disproportionately hold leadership positions. How can I shape conversations with these men to help them engage with this conversation and ultimately prioritize it? I work in men's health, and I've seen the ripple effect of helping men better understand women's health and always looking for more ways to raise awareness.
Yeah, brilliant. Yeah, that one it did definitely catch my eye when it popped up in the chat. I think we've started to kind of scratch away at this anyway, with what Debra and Mel were sharing. But I suppose to start to think about how you're going to shape your conversations, which I think is probably the first point here, is try and focus on something quite simple. So try and just get like one or two, maybe three things that you want to achieve with that population of leaders. A really, really good place to start is kind of shared values, really. So most leaders generally across the board really deeply, deeply care about performance. And they also care about the well-being and the retention of their teams as well. So really reframing women's health, including menopause as a business critical issue, really, and tying that into the opportunity to perform better as a business really helps to shift, I suppose, the nice to have, which it might be perceived as in some organisations as a conversation, into a must have conversation. So I think there's a big bit about reframing. I think, Debra, it was you that was saying kind of use storytelling, like make this personal, bring this to life in ways that they're going to understand it, whether that's encouraging stories of their own personal experience, whether it was their mothers as they were growing up or their partners that they're living with, also colleagues that they may be working with, but really helping bring those stories to life, have a platform for sharing. The Menopause Cafe has come up frequently, but also, we in a digital age have got some great channels such as, dedicated Teams chats for teams that, it doesn't matter what gender you are, but you can come and you're invited to the conversation to learn, to share, and really kind of help understand what people might be going through at these points in their life. And I suppose really inviting them into solution. Leaders like to find ways to get things done. They like to be able to solve problems. So, asking them, what would this look like for you? What do you need to be doing differently to champion this in your workplace? Give them the problem to solve. I think that's, most leaders don't like being done to. They like to be able to take part in the problem solving. So the education piece, bringing it to life in a way that is really personal and can really kind of, I guess, trigger something for the individual in terms of their why, but then giving them the opportunity to get involved in finding the solution. I think they probably my top tips.
Mel, I was just wondering if you wanted to build further on that question.
Yeah, I mean, I think the key thing really is creating an opportunity for people to ask questions. Like I said before, I think men face, from anecdotally from what we've heard, is there is a lot of fear of saying the wrong thing, and we're living in a suing culture. Where people are worried about saying the wrong thing for fear of potential repercussions on their own careers, or or things that are going on in their life. So actually creating a safe space for people to ask the questions because they genuinely care and they want to help, rather than it being like a stigmatizing questioning. Alice touched on, is it's about understanding people. So we know everyone's experience and journeys and symptoms are really, really different, but actually we can only really start understanding what someone is going through when we start talking to people. So asking them, how does women's health impact you in the workplace? What is it that you need support with? How can we as an employer really support you? And actually acknowledging that, regardless of the life stage or a well-being issue that a woman might be experiencing, there are days where our productivity and our awareness and alert, it's going to fluctuate every day. So actually just having that as, that understanding within the workplace, that might be the case, and that it's okay, that we're not expecting women or even anyone to be performing at their peak every single day of the week, because it's just not realistic. But if we create an environment where it's okay to acknowledge that without fear of stigma, without fear of judgment, then you're creating that culture and you're really building up that psychological safety.
Okay, moving on to the next question. And Sam, I think this one will be for you. And what are the top research areas in women's reproductive health under investigation at the moment?
Well, it might actually be one that's better for Mel, because I know Wellbeing of Women are supporting a lot of research. But I mean, as a GP at Bupa, it's not something that I'm necessarily getting involved with myself. Bupa are donating a percentage of every menopause plan that we sell that's to Wellbeing of Women, and they're doing some amazing research throughout the country. But I was fortunate enough recently to go up to Edinburgh and see some of the work that was being done there, looking at conditions like endometriosis, where we know that there has been historically such a delay in diagnosis. We still don't really know what causes it. We still don't know the best treatments for it. And they're doing some amazing work up there. I know there's a lot going on with menopause care as well. I don't know, Mel, if you've got any other specific examples that you can add.
Not specific, not off the top of my head, I'm afraid. It's we have a dedicated research team. So historically, the charity, we've been going for about 65 years. 60 years of that has been dedicated to research solely. We funded about £75 million into women's health research, and we're not prescriptive over the type of research that we fund as an organisation, because typically women's health makes up about 2% of the research historically. So we as an organisation will fund anything and everything. But as you touched on, Sam, like endometriosis is one of the big ones. Dr. Lucy Whitaker has done a lot of work in this area around endometriosis. But there's also things like PMDD, and we had a webinar recently on fibroids, and there's so much out there. But feel free to have a look on our website. There's so much information out there. And we also do have a dashboard, a research dashboard, where you can see where all of the investment has gone into research for women's health. But it's still such an underfunded area that there's it really does limit the treatment. And like you say, on average it takes 8 years for someone to be diagnosed with endometriosis, and often that this becomes, we don't have the level of expertise, we don't have the knowledge on it, and we don't have the treatment pathway. So, and that's why we're funding as much as we possibly can.
Thanks, Mel. Great. Okay, next question. So from a business return on investment point of view, so Debbie, I'll come to you for this one, if that's okay. How do companies measure the ROI of women's health initiatives, not just in wellbeing metrics, but retention and performance? And are there examples of women's health strategies influencing wider organisational change, so whether that's leadership development, culture, etc.?
I absolutely wish I could sit here and say, for every pound you as an organisation will put towards women's health initiatives, you will get £7 back, or whatever it is. But they seem to bandy a number around for mental health that for every pound you get £5 back. But it's so individual and it is so difficult to measure for some of the reasons that we've already spoken about today. One, if you're not actually, if you've not got the reason of women's health in as a reason for absence, a reason for leaving a business, you are not going to be able to track it. So my advice here would be, start tracking it. Look at your data now and get your base level. And data can come from a whole range of different sources. So absence and sickness is one, exit and your sort of staff retention. Why are people joining you? Could be your employee benefits, your private medical insurance claims experience. Is there anything in there indicating? So collate what data you do have and create your baseline. And if there are gaps and there are things that you want to be able to measure, then you need to start finding a way to do that. The things that have really helped us in terms of creating a business strategy was actually going for a pledge and accreditation. So as an employer, getting an external view as to what you're doing and what more you could be doing, I think that really helped us to navigate and prioritize, because you can't do everything at once, but you can make some really small changes that make a massive impact. And getting all different areas of the business involved in that as well, which is why having an external somebody can really help you, because then you get your HR people involved, you get your policy and practice, you get your reward and recognition, you get a whole range of different people. And that is what will drive significant change, I think.
Thanks, Debbie. Okay, so lots of great tips and advice there to work on. I think we've got one more time for one quick question in the chat. And Sam, I'll come to you for this one, if that's okay. Post-diagnosis depression, is this something that is currently being explored? Women are having to wait years for diagnosis, and after having that, to wait for treatment. Depression can kick in. Is this a missing part of the conversation? So it's a really good question.
Yeah, absolutely. It should be considered. And it comes back to what I was saying earlier about women being able to speak up once they do have a diagnosis and once they have started treatment as well. You know, as GPs, we recognise that low mood depression can very much be part of an endometriosis diagnosis, for example, living with that uncertainty about how the condition may develop, what effects it may have on fertility, whether you need to go and have operations or horrible medical treatments as well. So you know, as a clinician, that is something that I would be considering and would also be encouraging, you know, the workplaces to think about too, and remembering it's not those physical symptoms necessarily that are always troubling women the most. We've got to think about those psychological ones as well.
Completely. Thank you. Thanks, Sam. Okay, so just before we move on to the last slide, just to thank my panelists for answering all the questions there, and any that we hadn't got to in the chat, we will make sure we respond to and get out in a communication to you. And if we just jump onto the last slide, and then I'll close the session for today. So hopefully you've enjoyed and found the session really valuable. I think it's been an absolutely great discussion, and thank you to all of you for sharing your experience and your insights and tips and tools. So lots of takeaways there, which is absolutely amazing. Thank you all very much, and all different views as well, which was great. Lots of variety in there. And if you are wanting to attend further thought leadership events with Bupa, I just wanted to do a little plug at the end here for our Innovate 26 event, which we are now taking registrations for. So you can scan the QR code there, and then you can. It's actually attend by application only. It's for senior leaders in medium to large organisations and intermediaries and brokers as well. So if you would like to join, we'll be talking lots around new trends, technologies, movement in the health and wellbeing space. A full day's event, and we've run this now. This will be our third year, and it's been a hugely successful event. So if you would like to join, please do scan the QR code and register to attend, and we can get the invitations out to you. But on that note, it's 1 minute past, so time to go. Thank you all very much for joining us today. Thank you again to the panelists, and it's been a great discussion, and thank you for taking the time to join us. Have a great rest of the day. Bye-bye.